I'm Frances Zappala. I'm a pediatric cardiologist at the Nemours Cardiac Center, DuPont Hospital for Children. I'm also the director of the Integrative Medicine Program. Today we're going to talk about self-care, or physician heal thyself. And this is a really important topic because we're hearing more and more about what we call physician burnout. And the surveys are showing that almost 50% of physicians report some symptoms of burnout. And part of it is because of the long hours that we do and some of the stressful things that we're doing when we all work. When you look at the suicide rates amongst physicians compared to the general population, physician suicide is 70% higher in male physicians compared to any other profession, and 400 times higher among female physicians. Physicians are also 3.5 times more likely to abuse prescription drugs. Another alarming and very troublesome subject is that 1 in 4 medical students experience depression or have depressive symptoms during school and then later on during residency. Surveys have shown that 11% have had suicidal thoughts, and 15% of the affected students have sought professional care, which really isn't that much. Another is also showing amongst our residents that almost 30% of our residents have some depression or symptoms of depression, and again, not as many of them are seeking help like they should. So what can we do? One of the things is learning how to be mindful and meditate. And there are numerous studies showing the benefits of meditation, from decreasing stress and anxiety, lowering blood pressure and blood sugar, improving mood, improving sleep, enhancing immunity. When they've done studies with giving patients a flu shot, those who were regular meditators and who meditated afterwards showed more antibodies for the flu than those who didn't. It increases cortical thickness, increases the production of telomerase, which helps decrease aging, enhances pain control, and they're showing now some genetic expression, effects of genetic expression. Last year, the American Heart Association has also put recommendations that meditation can help improve cardiovascular health. Meditation and the brain. We know now that we have neuroplasticity, that our brain changes over time. We used to think that our brain was static, and we know now that everything that we think, that we do, that we experience has measurable changes on our brain. Studies have shown that people who meditate for as little as 30 minutes a day over an 8-week stress reduction course demonstrated measurable changes on a brain scanner. So what are some of the things that we could do? First, we can start off with practicing what we preach. We tell our patients all the time to take care of themselves, to make sure they make time for exercise, that they eat a healthy diet, that they sleep adequately. We need to follow our own recommendations. One of the simplest things to do is to learn how to breathe. Breathing is controlled both by our autonomic and our voluntary nervous system. Most of the time, we don't pay any attention to how we breathe. But when we make ourselves breathe slower, deeper, and more regular, we trigger the parasympathetic nervous system that triggers the relaxation response and helps ourselves to calm down. The more we practice this type of breathing, the more of an effect that it has on our bodies. So take a moment during the workday and practice some breathing. Before you go into the house at the end of an evening, especially if it's been a very stressful day, take a few moments in your car before you go into the house and take a few deep breaths. Take time for your significant other and your family. Put it in writing. Actually schedule it in your calendar as if you would schedule an appointment in your workday or a meeting. Schedule it and stick to it and spend some time with your family. Take a break and go out in nature. Studies have shown that spending time in nature is as beneficial as having a seated meditation practice. So if you're not one of those people who can just sit quietly, you need to move, go outside, even for 5 minutes. Take a quick nature break. Loving kindness meditation. This is a particular type of meditation that uses specific phrases, first to send love to ourselves, and then to our loved ones, and then to others. Studies have shown that physicians and people who practice loving kindness meditation not only increase compassion for themselves, but have more compassion for others. And it's a very simple script that you would recite, first saying, "May I be filled with loving kindness," and then picturing a loved one, wishing they be filled with loving kindness, and so forth. All you need is faith, trust, and a little bit of pixie dust. We need to learn to love ourselves and take time to take care of ourselves. That concludes this presentation. Thank you for your attention.